Okay, the following is going to be a list of frequently asked questions. Then I will just read off of some of the questions that were asked today. Again, this is coming to you from the St. Regis Hotel in Bangkok, Thailand, as we have just given the first, the kickoff lecture series on the artist robot and delivering some of the Asian experience or the Asian exposure to the robot. And so here are a few some good consumer patients that had asked these questions, both in today's session and in other sessions that we've done before. But what is a follicular unit? So what is the difference between a follicular unit transplantation and what's a follicular unit extraction? Okay, a follicular excuse me, follicular unit extraction techniques are basically where you take the follicular unit and you extract it. What's a follicular unit? Okay, well, we all know what hair follicles are, but very few people understand that your scalp hair grows in groupings. In fact, not just your scalp hair, but your body hair does too. And if you look really, really close at your arm hair or maybe your scalp hair and your hairline, you might actually witness with your own eyes what a follicular unit really is. They're groupings, and they typically contain anywhere from about 1 to 4 hairs, although in some ethnicities, in some patients, we see a high preponderance of multifollicular unit grafts, which go all the way up into the 6s, and occasionally we'll see a 7-hair follicular unit. In hair restoration, single hair follicular units are usually transplanted in an irregular pattern along the hairline to make it look relatively natural. What really doesn't look natural is when you get a big 2 or 3 hair follicular unit sticking right in the middle of your frontal hairline, and that kind of brings back old memories or nightmares of things that were done 20 to 30 years ago and make things look very unnatural and very surgical. Multiple hair follicular units are used usually towards the interior of the transplant in the anterior mid-scalp and towards the posterior mid-scalp in order to provide density. Okay, next question, and I'll break these up.